Myself, Dr. Kamini Mittal. I am guest faculty at Center of Food Technology, Allahabad University. I am presenting before you Module 6 of Paper 8, which is the paper for Women and Health, and it comes under the subject of Women's Studies. The title of the module is Declining Sex Ratio and Sex Determination, Part 2. This part deals with PCPNDT Act and concerns around it. It is authored by Ms. Bhuvaneshwari Sunil of TISS, Mumbai. In this module, we deal with the following topics. The context of the PNDT Act, that is the Prenatal Diagnostic Techniques Act. Aim of the PNDT Act of 1994, main concern of the PNDT Act, amendment of the PNDT Act, post-amendment, the definition of PNDT, larger concerns of the PCPNDT, that is preconception and prenatal diagnostic techniques. The PNDT were available since 1970s when All India Institute of Medical Sciences, New Delhi, conducted a study on efficacy and acceptability of amniocentesis in 1976. The government issued a partial ban on sex determination, not allowing tests to be conducted in government hospitals. A feminist movement in Bombay campaigned around selective sex determination using amniocentesis and ultrasound in 1982. But this movement failed because it was unable to address the issue of gender inequality and paid attention only to medical aspects that affected the baby and the uterus of the women. In 1985, a Forum Against Sex Determination and Sex Preselection was formed, FASDAP. In 1988, the state of Maharashtra imposed a legal ban on the prenatal diagnostic techniques. In 1990, a central bill similar to Maharashtra bill was introduced, but was not passed until 1994. Between 1988 and 1994, Punjab, Rajasthan and Haryana also passed laws banning sex determination. In 1996, the rules to the Act were developed. Although they succeeded in passing this social legislation, very little was done with regard to implementation. What is the aim of the PNDT Act? This Act is the act of regulation and prevention of misuse of prenatal diagnostic techniques. This Act was aimed at providing for the regulation of the use of prenatal diagnostic techniques for the purpose of detecting genetic or metabolic disorders or chromosomal abnormalities or certain congenital malformations or sex-linked disorders, and for the prevention of the misuse of such techniques for the purpose of prenatal sex determination. Now, the main concern of the PNDT Act. The Act, through the universal registration of clinics, equipments and licensing of practitioners, has sanctioned the private industry which has given rise to provision of sex determination under the guise of pregnancy screening. The possibility where the sex of the fetus could be determined and communicated through verbal or other gestures made it difficult to effectively prevent the misuse of technology. The Act was also criticized because of its limited view of the law regarding the reproductive technologies. Because while the law was being debated itself, new technologies like the pre-implantation and preconception technologies were being introduced in the country. The year 2003 saw amendment of the PNDT Act based on the directives of the Supreme Court for the proper implementation of the law based on public interest litigation filed in Supreme Court in the year 2000. The concern of the PIL was the continuing decline in sex ratio followed by the use of diagnostics, mainly the ultrasound tests, that had by then become integral as part of antenatal care provision. Now, the amended Act included these new technologies. Technologies that allowed sex selection to be undertaken during the preconception and pre-implantation stage, which were previously not included in the Act. It asked the clinics and doctors to maintain record that detailed the specific reason why an ultrasound or amniocentesis is performed for a pregnant woman. Post-amendment, the definition of prenatal diagnostic procedure can be thus stated. Prenatal diagnostic procedures means all gynecological or obstetrical or medical procedures such as ultrasonography, fetoscopy, taking or removing samples of amniotic fluid, chorionic, villi, embryo, blood or any other tissue or fluid of a man or of a woman before or after conception for being sent to genetic labs or genetic clinic for conducting any type of analysis or prenatal diagnostic tests for selection of sex before or after conception. Prenatal diagnostic test means ultrasonography or any test or analysis of amniotic fluid, chorionic villi, blood or any tissue or fluid of a pregnant woman or conceptus conducted to detect genetic or metabolic disorders or chromosomal abnormalities or congenital anomalies or hemoglobinopathies or sex-linked diseases. Now, what are the larger concerns of the PCPNDT Act? Actually, sex selection and sex determination mainly happens to prevent births of children affected or at risk of X-linked disorders, or preference of a balanced family with desired sex composition of children, or to have male offsprings and at the same time limit the number of children to one, influenced by the population stabilization programs. Now, there are some ethical and legal concerns regarding these genetic technologies. Pre-fertilization technologies such as flow cytometry enables the process of sex selection by sperm sorting that enables the separation of X from Y chromosome bearing sperm. These sex sperms are then used to fertilize the egg. Now, what is pre-implantation diagnosis? Pre-implantation genetic diagnosis through blastomere biopsy enables to ascertain sex during the post-fertilization and pre-transfer phase in assisted reproductive technologies. Post-implantation techniques most commonly used such as the ultrasound, chorionic villi sampling and amniocentesis help to abort between 8 to 20 weeks of pregnancy. Now, preconception sex selection methods do not destroy embryos or fetuses and are not as invasive as prenatal sex selection. But these procedures reinforce gender discrimination and emphasizes gender by itself favoring one over the other. There is disagreement regarding the issue of medical ethics and gender justice with the rapid advancements in the new reproductive technologies. In search of a perfect baby through genetic screening using various tests, some techno doctors do not see these technologies as a hazard to gender justice. Nivedita Menon says that if we consider this valid, that is, if we accept the validity of these technologies, we are accepting a hierarchy of human beings based on physical characteristics, the lower levels of which do not have the right to be born. But then this reasoning can be extended to other categories, such as females. The feminist argument is that since women would have the sole responsibility of looking after such children, they should have option of whether to bear them or not. The identical argument made about female children, that because the social pressure to bear male children falls entirely on the woman, she should have the right to abort a female fetus. Feminists argue that since individual women have to deal with the consequences of giving birth to every kind of fetus, they should be permitted abortion, but only if they know nothing about the fetus they are aborting. What are the interaction of the PCPNDT with the MTP Act? The tests such as ultrasound, routinely used to monitor pregnancy during the antenatal period, can also reveal the sex of the fetus. An assumption is that second trimester abortions are the result of sex determination, and this is a cause of concern. Now, there is difficulty in monitoring the link between a radiologist or a doctor disclosing the status of the sex of the fetus and the woman having an abortion in yet another setting. And so care should be taken regarding it, that whether a doctor has disclosed the status and because of that the woman is undertaking abortion. The strict enforcement of the PCPNDT Act has led to essential abortion services to women going underground. Due to the fear of PCPNDT authorities, many private medical practitioners are refusing to provide abortion services, especially second trimester abortions. The main reason stated by practitioners for non-provision of services is to protect themselves from harassment and criminal prosecution by the state authorities. The private medical practitioners have also denied abortions to unmarried girls, single women, and for pregnancies caused by rape for fear of any inquiry jeopardizing their practice. Denial happens to those women who are not likely to have carried out sex determination or wanted an abortion for this reason. This curbs women's right to safe and legal abortion because there is lack of safe abortion service providers and because of the pressure of the external campaigns that direct them to unlicensed providers, endangering themselves at the cost of their health. The feminists came to an understanding that abortion should not be referred to as feticide, since it signifies an emotive word suggesting murder, like homicide means murder of a man by a man. Infanticide means murder of an infant by someone. Similarly, on the same logic, we can consider feticide being murder of a fetus. It also implies that fetus is a separate person. So, what has been recommended by the feminist is to use abortion of pregnancy instead of feticide, because abortion of a pregnancy prioritizes the pregnant woman as the implicit subject. Further, there is need to recognize that there is an intersection of multiple factors that makes it hard to implement the PCPNDT Act. The market economy oriented by profits that also raises the concerns of ethical, moral, and future gender concerns. It is very important to remember that it should not be at the cost of women's access to safe abortion services. Now, what are the government initiatives to restrict the sex determination acts at different levels? According to the government, all sonography centers and genetic related centers have to be registered. Institution or agency has to be banned to advertise or display promotional posters or television serials that suggest any inviting gestures involving or supporting sex selective abortion. The government has also made a change of slogans to "Daughters are not for slaughters," like "No to sex determination" and "Yes to empowerment of women." Yet another slogan is "No to sex determination" and "Yes to gender justice." While the usefulness of several technological advancement is appreciated by most of us, the negative impact of these technologies need careful monitoring. Thank you.